that you all came this morning. We have wonderful, that we're very happy to have our health plan carriers here today with us. And the meeting will actually be facilitated and led by our benefit consultant, Anne Marie Estrada. And we have Joy Balomo from MHN, Maria Bevels from Kaiser, Renee Salvador from VSP, and Peggy Nieto from Delta Dental. So enjoy their presentation and ask questions. This is for you.
Thank you, Joy. Maria from Kaiser.
Okay, good morning, everyone. As Anne-Marie said, my name is Maria Bevels, and I am an enrollment specialist with Kaiser, and actually have been a member for the past 7 years. What we're doing today is going over your benefits and talk about all the resources that are available to our members, because if you've seen all of our commercials, we really strive and promote healthy lifestyles. Okay, at Kaiser Permanente, we believe that there are 5 elements that should be part of every health plan. The first one is that we believe you should have a choice of great doctors. At Kaiser Permanente, we choose from some of the best medical schools. In fact, out of 8 applicants, only 1 doctor will become a Kaiser doctor. Once he is selected, he has to go through a 3-year period where he is monitored and mentored by a senior Kaiser physician. Now, once selected, he will become a partner of Kaiser. You can view information concerning our doctors by visiting the Kaiser website, and it's just kp.org. There, you will find a short biography of all of our doctors. At Kaiser Permanente, you're free to choose the doctor of your choice, and you can change that doctor at any time. With Kaiser, there is no time frame in which you need to do it. Basically, if I was to call Kaiser this morning to change my doctor, I could go see that doctor this afternoon, because you're never locked into any one particular doctor. The other element we feel is very important is that your health plan should make it easier for you to manage your care. For this reason, you will find that all of our medical offices have pharmacies, laboratories, as well as your doctors. So you can go in and see your doctor, you can get your lab tests, x-rays, and refills on your medications all during the same visit. So all this saves you time and money. The third item we feel is important is that you should have care when and where you need it. Now, we recognize that it's not always possible to seek services during the normal workday. So for this reason, you will find that we have urgent care facilities that are open after hours. Many of them open after your doctor's office closes, generally about 5 o'clock. And then depending on the area that you visit, they may be open as late as 9, 11 o'clock. Some of those are open half days on Saturdays as well as on Sundays. As a member, you receive a guidebook which outlines where all of the urgent care facilities are, will outline the times of operation, and so on. The closest urgent care facility here is the one in Downey. We have our Downey Hospital, that's a new hospital with all the latest in technology. We have a medical office here in Long Beach and Pacific Coast Highway. But again, all that information is found within our guidebook. We also want you to have peace of mind in knowing that you will be covered for any life-threatening emergency regardless of where you may be. The only requirement is that you contact Kaiser, and we say within 24 hours or as soon as reasonably possible to let them know of the emergency. And then, of course, you will also have access to our 24-hour nurse line, who is available to you 7 days a week, 24 hours a day. The nurse can assist you in resolving minor issues. She can also assist you in scheduling urgent care appointments. So by providing all these services, you do have access to care 24 hours a day. Another item we feel is very important is all of the resources that we provide to you as members. So no matter what age or stage you are in life, you will find something to help you maintain that healthy lifestyle. In our website, you're going to find programs for smoking cessation, we have diabetes programs, we have stress management, we have nutrition, we have healthy recipes, to name a few. So I encourage you to be, if you are a member, to register with Kaiser Online and review all the resources that are available to you, because again, all these are intended to help you stay healthy. And then the last thing that we feel is very important is our electronic health medical record system. All of your information is maintained within this system. This is one of the reasons why, as a Kaiser member, you can visit any medical facility for care. You're not locked into one location. Because regardless of the facility that you visit, that doctor can pull up the latest information about your health. To illustrate that, just let me take a couple of minutes to go over something that happened to one of our members. We have a member who was a pilot who works with one of the airlines, and when he went in to visit, went in for his annual checkup with the airlines, he didn't pass the eye vision portion of it. So he then proceeded and visited his Kaiser doctor, who ran additional tests. That doctor could not see anything where they could correct his vision where it should be. She in turn recommended that he go see the specialist who was just down the hall. The specialist also did additional testing and realized that something wasn't right. They went and sent him in for an MRI. Upon reviewing the results of the MRI, they contacted a neurosurgeon who was 30 miles away within his office. Once he was contacted, all of the providers, his primary care physician, the specialist, as well as that neurosurgeon, were able to review his results. And from within his office, 30 miles away, they realized that this member had a tumor. They contacted the member who came in to see the specialist, and they were able to perform surgery on our member within 36 hours. So that's how quickly it was done. And that illustrates the importance of our electronic medical record system. And we're happy to say that 6 weeks later, our member is again flying. So this is a success story that I wanted to share with you. In addition to being a member, you will have access to My Health Manager. My Health Manager is an online program that allows you to manage your care 24 hours a day, 7 days a week. It is a secure program. Once registered, you can actually go online and email your doctor any routine question. Our website says they respond within 2 business days. Many times they do respond to you that same day. I know my husband uses this service, and once you have a really good relationship with your doctor, he can actually recommend medication by emails. He can give you referrals to specialists. And in my husband's instance, his doctor has actually called him a couple of times and asked him for more information, and has prevented him from having to go into the office and pay that co-payment. So everything was done by email and by a phone call. But in addition to that, you can also go through our website and view most lab results. And then depending on the time of day that you go in for your lab work, if you go in the morning, many times there's lab results available to you that same day. You will receive an email from Kaiser letting you know that your lab results are available. And they do it does go into detail. It's not just, you are fine or whatever. It does go into detail about that lab results. So if you're interested in knowing what was the purpose of the results, what ranges it's supposed to be on, there's additional resources that you can click on and get that information. But in addition to that, You can schedule routine appointments through our website. And the way that works, they will usually respond to you by giving you a choice of 3 different times, and then you can select the one that's most convenient for you. You can request refills on medications through our website. You can send an email to the pharmacist. And actually, any provider that you have seen within Kaiser, not just your primary care physician, you will be able to email that doctor. As far as immunization records are concerned, you can actually download that information through the Kaiser website. So those of you that have small children, you need that information for the schools, you can download that information and you don't have to go in and visit your doctor and pay that co-payment. And then you can also view both past and future information concerning any of your visits within the Kaiser facilities. So again, we encourage you to visit the website, register with Kaiser Online, and you can register by using your medical record number, and they will email a password to you. And again, I want to tell you, it is a secure program. No one has access to this program. And then one other thing I failed to mention is you can take a total health assessment through our website. Once you do that, it is reviewed by Kaiser. And again, it is confidential. It will not be made part of your medical record unless you instruct us to do that, okay? Once you respond to that questionnaire, it will link you to one of our healthy lifestyle programs. So as an example, if your responses led us to believe that you needed to go into a weight management program, it would link you to one of those programs. Or if you were diabetic, it would link you to that program as well. So please take advantage of everything that's available to you. And then not only that, I want to mention that not only on our website, but through our medical centers, we offer health education classes. Many of those classes are intended to keep our members healthy or to teach our members how to live with their medical condition. So as an example, if you needed a stress management program, we have something for that. If you were diabetic, you can also take advantage of those programs. Now, some of those programs do require your co-payment. Others would be free to our members. And then we also have a couple of programs that would allow you to take a friend with you, a non-member. As an example, it would be a class for yoga or Tai Chi. We know it's very hard to get our members to get in there and start exercising, so we can take a friend with us and give us that encouragement. So you can get more information concerning the classes at the medical centers by either visiting the website or calling our member services department. The plan that is being offered here is our HMO plan. Under this plan has been in place for last several years. It does not require any paperwork. You will never receive anything in the mail from Kaiser. And as I mentioned, nothing has changed within your plan, so there's no deductible. Your maximum out-of-pocket is $1,500 per individual or $3,000 per family. And what this means to you is that all your co-payments accumulate to that maximum out-of-pocket amount. If you ever reach that amount, then your services are covered at 100% level with no further co-payments being required. And that would apply to all your services except for your medications. Your medications would always require your co-payment. And as you can see by your co-payments, it would really be hard to reach that $1,500 amount. You'd have to be really, really sick to reach that amount. So, your doctor's office visits, whenever you're visiting your doctor, whether it's your doctor, your specialist, or urgent care facility, are covered with a $20 copayment. Most lab tests and x-rays are at no charge. Whenever needing outpatient surgery, it is a $20 copayment per procedure. They do so many services or surgeries on an outpatient basis now. I know my husband had a double hernia surgery, outpatient basis. He went in the morning, came home that same night. And guess who was required to take care of him once he got home? It was me. So $20 copayment for outpatient services is great. If you need to be hospitalized, there's no charge. Treatment in the emergency room of a hospital is subject to a $100 copayment. As far as your medications are concerned, note there is a $15 copayment that applies if you are ever taking maintenance medication. As an example, medication for high blood pressure, cholesterol, anything that you have to take for an extended period of time, you can get up to a 100-day supply with that one copayment. Included in your plan, as was mentioned earlier, all your preventative care services are covered at no charge. One thing I do want to mention, because it does mention diabetic screenings, if it's part of your routine exam, no charge. But if it is discovered that you are a diabetic, or if there is a diagnosis that is attached to that particular test, you will have to pay a copayment. So let's say as a diabetic, your doctor is requiring you to go in every 6 months because he wants to check your sugar levels. That's considered an illness, so you would be paying a copayment. But other than that, covered at no charge. And on my table, I do have a flyer that talks about all the recommended screenings, and you could pick those up as you come by or as you leave. Here, we just want to remind you to use urgent care facilities whenever possible. Remember, you're only going to pay a $20 copayment when using the urgent care facility. Treatment in the emergency room of a hospital is $100. Remember, when you go to the emergency room of a hospital, you shouldn't be going there unless it's a life-threatening emergency. So not only will you be paying more out of your pocket, but you're going to experience those long delays when going to the emergency room because they will always see the most serious patients first. As a member, remember, take advantage of all your preventative care services, ask questions. When seeing your Kaiser doctor, they will always recommend generic medications versus brand. So be assured that you will be getting generic medications, and then visit urgent care again when possible versus emergency room. Any questions concerning your Kaiser benefits? Yes.
If you're transported to a hospital that's non-Kaiser for a life-threatening circumstance, you pay $100 to Kaiser. Is that still qualify as a $100 copay?
The $100 copayment still qualifies, and just to mention, whenever admitted to a non-Kaiser facility, once your condition is stabilized, Kaiser does move you to a Kaiser hospital. Okay? I think you had a question. Here in the first table.
Could you go over the prescription benefits? Because is there a difference between going to the counter to get to the pharmacy to get your prescription refilled versus doing a mail order?
No, the copayment, the same copayment applies. The difference is that it saves you time. If you're taking maintenance medication, you can request your refills by going through our mail order service. And actually, when you call to request a refill, they will ask you, do you want these mailed? Do you want to pick these up at the pharmacy? There is no charge in getting these mailed to your home, but it's very easy to do mail order. Saves you that trip to the pharmacy.
That was asked. The $100 copay, if you're taken to a hospital that is non-Kaiser, you would still pay $100. You wouldn't pay the hospital.
Okay, if you're taken to the emergency room of a hospital, the $100 would apply.
Okay.
If you're admitted to the hospital, it doesn't apply. Okay?
Okay, so then
Okay, the question was,
you'd be
we wanted
responsible
to,
for the
yeah,
payment to
she
the
wanted to
hospital?
clarify what happens in the event you are taken to a non-Kaiser facility. Okay, if it is just to emergency room, it is the $100 copayment. If you happen to be admitted to the hospital, the copayment does not apply, and it would be covered at no charge, regardless of the hospital that you're admitted to. Once your condition is stabilized, they will move you to a Kaiser facility. Okay, I believe the question, if I heard it correctly, was Once admitted to a non-Kaiser hospital, you pay your it's covered at no charge, right? And then if you're admitted, once you're transferred to the Kaiser facility, will there be an additional charge? You only have to pay the $100 co-payment one time, if in the emergency room. Now, let me verify what the services are for ambulance. There is no charge for transportation by ambulance. To any hospital. And one thing I do want to mention, if you are admitted to a non-Kaiser facility, that non-Kaiser facility or hospital should be billing Kaiser directly. In the event that you get a billing from, because it does happen, if you get a billing from that non-Kaiser hospital, please contact Kaiser's Member Services Department to verify that they have billed Kaiser. For instance, again, she is inquiring about the billing she received and who is going to be responsible for that billing. Again, any services that you receive from a non-Kaiser facility because it was an emergency or whatever will be covered by Kaiser. So again, you can submit that bill to Kaiser. Okay, again, she's inquiring concerning the questionnaire she got from Rawlings. Again, I'm not sure what you received, so you do need to stop by and see me, and I can get that information and look into it for you.
I believe what happens is when you go to a medical provider or hospital, they stand as a standard question they ask, was this a work-related injury? If the person says yes or gives them any kind of answer that they think could be, they may automatically send you the paperwork from the third-party provider, which is the workers' compensation third-party provider for the employer. So that's pretty standard now. You'll always get those questions, and they may automatically just give you the paperwork just in case, because that wouldn't necessarily be a Kaiser billing situation. It could be the employer's circumstance. Could be Lakewood Mall's third-party provider.
In that case, for third-party subrogation, I would suggest that if it was not a work injury, then you just complete it, fill it out, and then return it. If you have any question, then I would maybe just send it over to Kaiser. They do have a department who will complete that information. Okay?
Okay, again, the question is, if you're traveling out of state and you become ill, you are covered for urgent situations, anything that would be medically necessary. You can, many times you will be requested to pay for your services when you're out of the area. You would collect the receipts, and then once you return, you would submit those to Kaiser, and Kaiser would process that claim.
Is that safe around the country?
Out of the country, wherever you may be, you will be covered for any situation. Again, it has to be medically necessary. Any other questions? Right here. Yes, sir.
Well, it's more of a comment. I've had 2 occasions where I've had to use Kaiser for out-of-state services, and the best thing you can do is have the Kaiser travel form with you at all times, and then immediately upon seeing the doctors, contact Kaiser on the internet and get their forms immediately and have that establishment deal with Kaiser on a direct basis. That way you won't run into a lot of problems. Have the forms with you, or have that facility download Kaiser's forms to get the process started immediately. It's been a great help.
Okay, I don't know if everyone heard the gentleman. Yes? Okay, great. We do have, you can download those from our website, as well as calling our member services and asking for the vacation package. That is available to you. And then also on your Kaiser ID card, there is an 800 number on the back that directs you and what you should do and where to call if you ever need services out of the area. Any other questions? Yes, ma'am.
Throughout the year, she gets monetary compensation. I didn't know if Kaiser offers a program like that.
Yes, we do. We do offer discount programs, and that was the next slide. Okay, as a member, we do offer various discounts. We have discounts for acupuncture care, for chiropractor, and then fitness centers. Now, you do have to visit the Kaiser website to determine which fitness centers are involved with the discount program. And generally, when you go into the section that talks about member discounts, if you're interested in the fitness centers, you can put in your zip code, and they will tell you which fitness centers are participating in the discount programs. And then we also offer discounts for curves for the women if you're interested in something like that. There's a discount program for curves, and it applies to the membership fee. Okay, any other questions at this time? Yes, but you should be able to seek services regardless of what you may be.
I had no trouble with
Yeah.
it. Now, how does the copay apply there?
No, the copays, regardless of where you receive care, will always be the same. Okay, any other questions?
It's a unique medical question, but Kaiser does not allow for women to have access to bioidentical hormones. And you no longer prescribe estrogen because it's linked to cancer. So when is Kaiser going to get up to speed and offer bioidenticals for women?
I don't have an answer for you at this time. I really don't know. I could look into it and get back to Joan or Evelyn, but I don't have an answer for that right now.
My doctor would like to, not that I would need them now, but she can't because you don't allow it.
Okay, I will look into it and get back to you, okay? Okay, I want to thank everyone for your attention, and I will be at the table if you have any other issues. Thank you very much.
Thank you, Maria. Next, we have Joan Balamo from MHN, who will go over your behavioral health and EAP. Again, Maria will be here all day today if you have any further questions or would like to stop by her table to pick up information.
Good morning and thank you for the time. I'm Joy with MHN. MHN is the behavioral health, which is your mental health and substance use disorder provider, as well as your employee assistance program provider. What we do on the behavioral health is it's treatment for serious mental health and substance abuse issues. So you can get treatment for cognizant disorders. You can get treatment for eating disorders such as bulimia or anorexia, schizophrenia, bipolar, those types of problems. Serious, severe depression, you would get treatment in that method. Treatment methods include hospitalization, treatment centers, sometimes outpatient or daycare centers. MHN is nationwide, okay? So anywhere you're traveling within the nation, and if a behavioral health issue arises, you can call the 800 number and they will direct you to a facility in that area. The EAP is also nationwide, so we have providers throughout the country. So if you have a young child or a child who's gone away to college and they're anywhere in the country and they need to have some EAP sessions, all they do is call the 800 number and they can get help. The EAP is for less severe problems. We hope that you use it and your dependents use it so that you can address issues prior to them becoming so significant that you need to use your behavioral health. They also help you with marital issues and child rearing issues and things of that nature. EAP benefits as well as your behavioral health are totally confidential. You call 1-800 number to access care for either service. You will tell the intake person that you're looking for behavioral health services, or you'll tell them that you're looking for EAP services. They will then do a quick assessment with you. Now, when you call in, if you are in a crisis situation, you can tell the intake person that, and they will transfer you immediately to a staff clinician who can help you. Okay, so if you are having an immediate issue, an emerging issue, Tell them that, and they will transfer you to a staff clinician. Otherwise, if you're going to use the EAP benefits, they will give you the names of 3 providers in your area, and you give them a zip code, and it could be near your home, it could be near work, wherever you want it to be. And they'll provide you the name of 3 providers. You then look and see which provider you think would be closest, whatever criteria you want to use to pick the provider. You then make your appointment, and you go see the provider. The appointments can take between 3 and 5 days to set up. There are 3 ways to access care, and earlier today I couldn't read my own writing. You get 3 EAP sessions face-to-face for any issue during the year. So if you're having a grief issue at one point, you can go get 3 face-to-face. Later on in the year, if you're having, maybe you're feeling depressed or anxious, you can get another 3 face-to-face. So every incident gives you face-to-face visits. The other 2 ways to access care are telephonic and web video consulting. MHN's the only company to offer web video consulting. What that is Skype-based, and if you have Skype on your home computer, your laptop, your tablet, your smartphone, you can tell the intake person that you want to get your treatment through web video. They will immediately warm transfer you to a person in our Tempe office where we do the web video counseling, and they will sign you up for an appointment. Those appointments can generally be scheduled within 24 hours, quicker than the face-to-face. You'll be talking with a counselor who works for MHN out of the Tempe, Arizona office. They work until 9 o'clock Pacific Standard Time. They work on Saturdays and Sundays until 3 o'clock. Okay? And then you would develop with that person, and you would reschedule appointments so you always get the same clinician on the web video. So that's available to you. And web video and telephonic are until completion of the problem. So if it takes more than 3 visits, you can get more than 3 visits. They don't cost you anything. Okay? It's a great tool. We've been doing it for about 1.5 years. We've done it for 3.5 years with the Department of Defense for the military, and they do web video from all over the world. They access us from Afghanistan, Iraq, everywhere. So we know it works. So it's a great tool, and again, it gives you more sessions. Okay? The other part of the EAP benefit is the work-life services, and that gives you help with child care, elder care, any of those things that kind of take time that you can't seem to find during the day. So let's say you have a new baby and you want to find child care. You call the 800 number, tell them what you're looking for, and they will get back to you with the various child care facilities within that zip code. Same thing with elder care. It doesn't matter where your parents or your in-laws are, anywhere in the country, you give us the zip code and we will give you the facilities, whether it's an assisted living facility, adult daycare, whatever's in that area. We do not vet these. That's your responsibility, but it does at least get you that first step, which sometimes is the hardest to accessing this care. What are the facilities available? We also provide legal and financial and identity theft services for you, and we use a vendor partner for that. It again is nationwide. We have attorneys throughout the country. We also have financial advisors throughout the country who can help answer your questions. And they give you a 30-minute free consultation. The attorneys will give you, if you need to see them for more sessions to do something, whatever the legal issue is, you can get a 25% discount on their hourly fee, which can save you an awful lot of money when you're working with an attorney. The one thing you cannot do is you cannot have them help you sue your employer, okay? Which makes the school very happy and all employers very happy. We also have a great website, and it's members.mhn.com. If you have not been on the website, I really encourage you to go on that website. It has a lot of information. It's constantly updated. What you need to do, you can access it two ways. Once you go in and you see where it says EAP, you click on that, and you can either just use an access code, which is LBCCD, to get into the website, or it will ask you to register, and by registering, you will give an email address and you'll set a password, and that's the password and the email address you'll use all the time in the future if you want to do that. The advantage of registering is that there are some things on the website that are locked unless you register, because there are things that need to send you information back once you do them, okay? So those are the two ways to access it. But as you can see here, if you go into the website, just using your access code, you can get financial and legal resources. You can get a lot of different legal documents that you can download, print, and fill out. Okay, one of them is a simple will if you don't have one, something you might want to think about. You just print it out, fill it out, sign it, have somebody witness it for you, and it's a legal binding document. On the financial side, there's a lot of articles about financial planning, the steps to a good financial planning resource for you, how you want to direct yourself, especially if you're getting closer to the golden years and you do want to retire and have some money. So they can help you with that. There are some calculators that you can use and you could put in, and they'll ask you various financial questions, and you fill that information out, and it'll show you if you're on the right track for retirement and how your plan is doing financially. Okay? Another thing on the website is wellness. Everybody's really hot on wellness now. We have a whole slew of health and wellness programs that you can access. On the wellness tab, when you go in there, you'll see something that is called a well-being assessment. It's a health risk assessment, but it covers a much broader spectrum, so it looks at you as a more complete, whole individual. You need to be registered to ask that. That's one of those that's locked. It's about a 20-minute questionnaire that you fill out. You will then be sent a report that tells you how well you're doing in various areas. It covers your physical health, it covers your mental health, it covers how happy you are with your personal life, how happy you are with your career, things of that nature. And it will it'll tell you if you're healthy, it'll tell you if you have some issues and you might want to start some programs, and what kind of programs that you might want to look into. It's a great program. Another thing on the website is self-help. There's a tab there for self-help, and there are some assessments that can tell you. There's one that's a weight assessment. There's one who doesn't have a weight assessment. There's one that's a depression monitor. So if you think you're starting to show symptoms of depression, you can go on and do this assessment, and it will let you know, yes, you are, no, you aren't. Maybe you want to talk to somebody because you're starting to go in the wrong direction. All those assessments are locked, so you would definitely need to register to access those. We also added this past year, an e-learning tab, and that is 15 to 20 minute e-learning vignettes that deal primarily with wellness, including financial health. So you could go on anytime, anywhere, any of your family members, retirees, click on that, click on whichever training you want to see, and you can just watch it anytime from home. Okay? At MHN, like I said, we're 24/7, 365. You call the 800 number. You don't have to put two 800 numbers in front of it. It's just 800-777-9355. Or you visit our website, okay? And I'll be providing the school with some brochures that have wallet cards to be handed out throughout the year. Any questions? Yes?
It's more comments.
Yes?
This is an outstanding program. And in Human Resources, we often refer employees to this program or give them the brochure. We do have brochures in Human Resources. If we are sensing that we have an employee under stress, overwhelmed with their personal life or work life. And it's done confidentially. If you're so overwhelmed, like you can't even navigate the system, we will assist you in Human Resources in making contact to get that first appointment if you need it. But it's also for children that are creating stress in the household, financial stress that's created in the household, partners or spouses as well can be referred to this. And not every employer has this program. And I cannot tell you how terrific it is because it's completely confidential. We'll never know if you access it, only if you ask our help in helping you access it. So it's completely confidential, and you can be secure that it's completely confidential.
Do I have to repeat all that? I hope not. Thank you. Thank you. Can you come to the rest of the sessions? That was great. Any other questions? Wow. Okay. Thank you for your time.
Thank you, Joy. Next, we have Peggy Nieto from Delta Dental.
You have two dental programs available to you, both a Delta PPO and Delta HMO. So I'm going to briefly walk you through the PPO and then the HMO. You have access to any provider, licensed provider of your choosing under your Delta PPO plan. What you want to try to target for if you want to achieve the biggest savings is the Delta PPO providers, because they will give you the most cost-effective, lowest cost contracted fees. The sheet here in front of you is just a reflection of what the same claim would look like under a PPO, a Premier, or a non-Delta dentist. So if you drop to the bottom line where it says patient savings, you'll see that under a PPO plan, your savings would be $64. Under a Premier provider, you'd only save $40. And with a Delta dentist, there would be no savings because essentially they have no contract with us. They're not required to discount their fee. As a PPO member, you have the flexibility of two networks to choose your dentist from, both our PPO and Premier networks. You will, as I said, achieve the highest savings seeing a PPO provider with 20 to 35% savings in your out-of-pocket cost compared to a non-Delta dentist. And there's no balanced billing. Whether you see a Delta PPO or Premier provider, that provider cannot bill you more than Delta's approved amount. Here's a snapshot of your plan as it currently stands. You have a $25 per person, $75 per family deductible. Your annual maximum if you're in network with a PPO provider is $2,200, $2,000 if you see a Delta Premier or non-Delta dentist. For diagnostic and preventative services, cleanings, x-rays, and exams, you have what we call an incentive program. 3 cleanings are provided per calendar year. On that incentive program, you start at 70% the first year. If you see a provider that calendar year for any services, the next January you bump to 80%. The next January you bump to 90%, and the next January you bump to 100%. You don't drop back down to 70 if you don't go a particular year. You just stay where you're at, and then you'll advance again after you have a claim again with Delta. If you have a break in service, however, if you go on a leave that's unpaid where you don't have benefits, and then you come back, then you would start again at 70%. I have had a couple of people come up to my table and tell me that recently their claims for their dependents dropped back down to 70%, even though they've not had a break in coverage. If that's happened to you, please call our customer service number and let them know. We recently changed to a new computer system, and it could just be that your dependents' information didn't transfer appropriately, and we need to get that cleared up. Basic benefits, which are fillings, oral surgeries, those types of things, endodontics, root canals, crowns, all of those things are covered on that incentive plan, so after 4 years you would be at 100%. Prosthodontic benefits are paid at 50%, that's bridges, partials, and dentures. And then you have a separate dental accident of $1,000 maximum per person per calendar year. So if you or a family member plays sports or has an accidental dental injury, make sure your provider checks that box on the claim form when they submit the claim to us that indicates it was related to a dental accident. So you're going to save the most money with a Delta PPO provider and the least amount of money with a non-Delta dentist. Common sense. I'm going to flip through this screen. You may need to complete a claim form if you see a non-Delta dentist, and some of them may charge you for completing that claim form, just like some medical providers are now charging to complete those forms. So if you're seeing a non-contracted Delta dentist, go to our website, download a claim form, take it with you, and then you can fill it out yourself and just attach the receipt, or if they are not charging you, go ahead and have them fill it out. We always recommend that you receive a pre-treatment estimate whenever costs are estimated to be $300 or more. The dentist is going to send their proposed treatment to us. We're going to run those proposed treatments through our system. Delta's going to calculate if any deductible applies and what your portion of the share of cost is going to be. And then we're going to send a report back to both you and your provider letting you know what the estimate is for the approved services and the amounts you'll be responsible for. And that's called a pre-treatment estimate. This is what your benefit statement looks like. You should be receiving this for any claim under your Delta PPO plan, whether it's a PPO Premier or non-Delta dentist. If you'll look in the middle of the claim form to the right-hand side, there's a line that says amount you owe your dental provider. That is only the amount he should be charging you if he's contracted with us. So if your provider is PPO or Premier and they're charging you more, they're violating their contract, and we want to know about that. If they're a non-Delta dentist, obviously they can charge you more than the amount shown on that form, because they can charge you anything essentially that they'd like. You can get paperless delivery of these notices of payment forms. Go to our website, click on the link for making your claims green. Delta will maintain 7 years of these forms online for you. Whenever we pay a claim, you'll get an email instead of this form. The email will say, we've processed your claim on such and such date. Click on the link. Check the form. If everything looks accurate, at that point, close the form if you don't need it. Print it out if you choose. You don't have to. You can close it, leave it on our system, and we will always maintain 7 years going forward from January 1, 2010. If you need them at a later date for your 125 plan or for tax purposes, you can go to our website and print them all out at one time rather than having to keep track of them during the calendar year. I like that option. Under the HMO plan, this is Delta's prepaid plan. It offers you affordable benefits while promoting diagnostic and preventative care. Most services are covered at no copayment. You have very predictable costs. Non-covered services are provided at the provider's discounted fee. Again, we always recommend you receive a pre-treatment estimate. There are no annual maximums or deductibles on the HMO plan, so for some of you, this might be a better budget acceptable alternative. It's easy for you as an enrollee. You sign up and select a contracted dentist, schedule your appointments, receive your dental care, pay your co-payment directly to the provider, no paperwork, no hassles, and like I said, a lot of the services on the plan are covered at no or very low co-pays. We have one of the nation's largest networks on our HMO, and you can change your provider every month to month if you'd like. By the 15th of the month, simply call our 800 number or go online to our website. The advantages to you of being a Delta Care USA member are that you have comprehensive benefits with almost everything covered at no copays. Plans are coming out that include enhanced benefits listed here. If you'd like to look at those options in the future, that is something that's available. Orthodontic highlights. We cover all 3 phases, limited, comprehensive, and what's called interceptive treatment. Coverage for both child and adult. Pre and post records are covered at a set co-payment. Extractions for orthodontics are covered, and we do have a takeover provision if you're new to the college, enrolling on the HMO, and have a family member currently undergoing orthodontic treatment. Please contact us regarding transitioning those benefits to Delta. You have out-of-area emergency services available to you on the plan up to $100. All specialty care will be coordinated by your primary care dentist. It's easy to switch your Delta Care provider. Just call our 800 number or go to our website. You can change it online on the website. If you do it by the 15th of the month, we will make it effective the 1st of the following month. We have multilingual customer service representatives available, and online you can check your benefits, you can search for a dentist, and you can download a number of dental health tips and wellness items. This is our Delta Dental website, deltadentalins.com. If you're looking for a provider, the little guy in the white coat on the lower right-hand corner, that will take you directly to our provider directory, whether it's HMO or PPO. You can print a new ID card. You can use Fee Finder to locate the average fee for a number of different dental dental procedures. You can also check your benefit and eligibility information. Just a snapshot of what our dentist directory looks like with a link to the maps and driving directions. If you need to contact our customer service folks at any time that you're on our website, there is a customer service request. Just click on the link, it'll take you to this form which you can fill out. There's Fee Finder. It has a drop-down menu for the different procedures available. Are there any questions? Okay, thank you for your time and attention.
All right, I am going to try to be brief. I know you've had a lot of information already, and the beauty of VSP is that it is usually pretty simple to use. Probably most of you have already used it, so you know exactly how it works. Just a quick history, VSP has been in business since 1955. We are the oldest and the largest vision plan in the country, and the reason that's important to you is because our doctors are familiar with the plan, and that makes your experience much easier. As well as for those of you who have dependents out of state, it's still a very simple plan to use because we have doctors in all 50 states. We believe that we give you the best value for your dollar. In many cases, our doctors will show you what's called a WellVision savings statement. And what that is it's a side-by-side comparison between what you would have paid if you had no insurance and what you actually paid by using VSP. That's when you can generally see the true savings and you get a big bang for your buck because of VSP. We have a member promise where we guarantee 100% satisfaction, or we will do whatever it takes to make you happy. The great thing about VSP doctors is our network is comprised of private practice optometrists and ophthalmologists who've been in business on average about 15 years each. So they truly get to know your eye history, your health conditions, any type of special things that they need to know they are aware of because they've been in business a long time, and generally you have been seeing them for a long time. They are generally close to where you live or work. We were started here in California, so we do have the largest amount of doctors in California, so you've probably noticed just about anywhere you go, whether it's in a mall or you're driving around, it's a strip mall or a medical building, there is probably a VSP doctor there. Most doctors are open evening and weekends for your convenience, and some even early morning in those medical buildings as well. This is your benefit, so this is a snapshot of exactly what you can expect when you go in to see your doctor. You have a $10 copayment. For that $10, you get an exam every plan year, covered in full. You get lenses covered in full every plan year as well, as long as they're lined bifocal, trifocal, or single vision in glass or plastic. The only thing that you're paying for is if you get additional things on your lenses, such as tints or coatings. You would pay more then, however, you would be given a discount. As far as frames, you are eligible for one frame every other plan year, covered up to $120. If you go over that $120 allowance, then you are given a 20% discount on the difference. So you continue to save, and you're certainly not tied into any particular frame collection. You can use that $120 on any frame in the shop. If you're somebody who wears contact lenses, then it's either or, so you can choose to use your benefit for frame and lenses, or you can choose to take that $120 allowance and use it towards your contact lenses. On the very right, you see the out-of-network benefits. I won't go into detail on those. However, it is good for you to know that if you choose not to see a VSP doctor, you will be reimbursed a portion of what you paid. For the most part, you would pay up front whatever their usual and customary fees are, and these are the amounts you would expect to come back from VSP to you. Just like all of your other plans, whether they be your medical or your dental plans, it's always going to be most beneficial for you to stay within the network. Okay? The Well Vision exam is the most comprehensive in the industry, so not only are they checking and doing a refraction so that they can get a prescription to fill for you, but they're also checking for chronic conditions such as these here, diabetes, high blood pressure, high cholesterol, glaucoma, cataracts. Remember, this is the one place on your body that a doctor can see your blood vessels without having to cut you open. In many cases, VSP doctors are the doctors who are seeing signs of these conditions before your medical doctor even. We know that out of every 10 people who have a medical plan, 1 in 10 is going in for their yearly annual eye exam, or I'm sorry, their yearly health exam, whereas 6 in 10 go in for their yearly eye exam. So it's an important starting point for you whether or not you wear glasses. There's great savings with your VSP doctor, so in addition to your benefit, you also get an average saving on all non-covered options of about 35 to 40%, and generally it's even more than that. What VSP offers that others don't is that those extra options are cost control. That's different than just a discount. With just a discount, the doctor's office is free to charge you whatever they'd like and then take off a percentage from there. We all know how that works. With VSP doctors, they are actually cost control with these options. So you can go into any of our doctors in any 50 states, and that same tint or anti-reflective coating or progressive lens is going to charge you the same. They're going to charge you the same amount, and it's only up to a certain allowance that we actually dictate for them. So they love that, but it is a great benefit for you. You are entitled to 30% off of any additional pairs of glasses that you get on the same day from the same doctor's office. So for those of you who need an extra pair for reading or maybe for sport that you play, you do continue to save. And if you go after the same day within 12 months, you still get a 20% discount on as many pairs of glasses as you'd like. In addition, for those of you who wear contact lenses, you know that there is an added part to the exam where they actually have to do different types of measurements to be able to fit you with contacts, and for that, doctors can charge more. However, because you're a VSP member, optometrists and ophthalmologists in our plan do have to take 15% off of any overages there. If somebody is interested in LASIK, we do contract with certain centers, and you can find out those centers and more information on our website, but it's about a 15% discount on LASIK. And the other great thing about anybody who's had LASIK or is maybe thinking about it, you can still use your VSP frame benefit to get a pair of non-prescription sunglasses even after you've had the procedure. As far as using your benefit, you can either go on our website, call the toll-free number, or come see me at my table today because I do have paper doctor lists to find a doctor. Once you do find one, you call, make your appointment, identify yourself as a VSP member, and then you simply show up. It's really simple. There's no ID card, there's no claim form. Once the doctor knows that you are a VSP member, he works with us behind the scenes, and you simply show up. We have a very large network of private practice doctors, as we talked about before. A couple of the things that's important to you, we try to make it simple. So one of the qualifications for a doctor to be part of our network is that they also house a dispensary. So the same doctor's office must have frames for you to choose from and lenses as well, and be able to fabricate those for you by using a lab. So it makes it really easy. You can do one-stop shopping. In addition to private practice doctors, we now contract on an out-of-network basis. So it's important, I don't want to confuse you. On an out-of-network basis for an out-of-network allowances, you can go to Walmart and Costco. They will bill us directly behind the scenes, and you're going to get the out-of-network amounts, but instead of having to pay up front and wait for reimbursement and submit the receipts yourself, they'll do all of that behind the scenes, so you would just pay any additional costs. Okay? If anybody wants more information, come see me. I don't want to confuse you on that. This is all about our member services. Go onto our website, call our toll-free number if you think of any questions after today. Our customer service over the phone is unique in that you usually don't have to wait longer than 20 seconds as far as hold time. So that's really nice. I know for me, I get tired of holding and pushing a whole lot of buttons, so you generally get a live person. That's it. Do you want me to take questions now or wait? Does anybody have any questions?
Any questions? Hi, Renee. You said that you mentioned Costco and Walmart. Does that also include Sam's Club?
It does include Sam's Club. Thank you for asking. Okay, again, my name is Renee Salvador. I am at my table and would love to meet you if you think of any questions afterward.
Thank you, Renee. This will conclude this session of the benefit workshop.